So the topic that I'm presenting is chemotherapy-induced alopecia, prevention and rehabilitation. Chemotherapy works by targeting all rapidly dividing cells in the body. Hair is the second fastest dividing cell in the body, and up to 90% of them are in an active growing anagen phase. Chemotherapy induced keratinocyte apoptosis and hair follicle regression, as well as impaired metabolism and mitotic processes in the anagen hair follicles. All of this results in rapid and extensive alopecia. A patient's hair can be a major part of their identity, and many patients rate hair loss as one of the most devastating side effects of chemotherapy. Chemotherapy-induced alopecia is an unwelcome reminder of disease, one that can negatively affect the self-image, confidence, overall sense of well-being, and a patient's attitude towards treatment. The various methods that can be employed for prevention of chemotherapy-induced alopecia have been tried and tested since many decades, but unfortunately, none of them have worked until the scalp cooling system, which is a proven approach to reduce chemotherapy-induced alopecia, and it has been used successfully by thousands of patients worldwide to maintain privacy, self-esteem, and control during a critical period of treatment. Certain other treatments which have been tested, like minoxidil, bimatoprost, it is advised by the FDA that they should not be used during chemotherapy administration, but they can be used after chemotherapy discontinuation to obtain a greater regrowth of hair. So what is scalp cooling? Scalp cooling is a proven approach to reduce chemotherapy-induced alopecia. The reduced temperature that it achieves results in a decreased blood flow to the scalp area so that less chemotherapy reaches the hair cells. Hair cells are therefore not exposed to the full dose of chemotherapy and may be able to survive the chemotherapy treatment. As a result, the hair is less likely to fall out. So there are two basic physiological reactions which occur during scalp cooling. There is a reduced blood flow due to the vasoconstriction in the localized scalp area, which limits the amount of chemotherapy agent delivered to the scalp and the hair follicles. And there's a reduced reaction rate. The lower scalp temperature decreases the metabolism of the normal hair follicle in that localized scalp area to slow dramatically. Fewer chemotherapy agents are then absorbed by the hair cells and the damage is significantly lower. So this is a typical scalp cooling system that we have also personally used. And this is how the treatment cycle goes. So you fit the cap with the pre-medication, and there's a pre-infusion cooling time of around 30 minutes. Then you start the infusion, and the infusion time would be the time that your chemotherapy medicine takes to be delivered inside the body. Then once the drug infusion ends, you start the post-cooling time, which could be ranging from 45 minutes to 1.5 hours as well. And then you re-acclimatize the patient. So this is how pictorially the scalp cooling mechanism works. The reduced temperature, reduced metabolism, reduced blood flow results in reduced absorption of the chemotherapy drug, and there's a reduced hair fall. So scalp cooling has successfully reduced alopecia in breast cancer patients. This is the cohort of patient that has been tried with scalp cooling for the longest duration, as well as the in terms of number of patients who have experienced the scalp cooling induced prevention of chemotherapy alopecia. So for this is the study that was published in Breast in 2018. Both the drugs anthracycline as well as taxane based chemotherapy was included, and it was shown that there was an 88% success rate with taxanes and overall 71% success in patients of breast cancer who were treated with chemotherapy with the amalgamation of scalp cooling to significantly reduce the alopecia. So if we increase the post-infusion scalp cooling time, it has been found that the grade of alopecia improves. However, it still did not improve the use of a wig or a head covering. So the average scalp cooling time that we allow is roughly between 1 to 1.5 hours. Another study which was published by the Scalp randomized control trial, which was published in JAMA. So again, taxanes and anthracyclines both were used in the breast cancer cohort of patients, and there was 50% retention of hair by this study. So this is a study that we published with our experience of 100 patients who experienced the scalp cooling system in preventing the chemotherapy-induced alopecia. If we see, there was a better outcome with the taxane-based chemotherapy, and the scalp cooling sessions were very well tolerated. There were no serious adverse events. Scalp metastasis and scalp cooling discontinuation was also observed to be very, very rare. There was only one patient who had a scalp metastasis, but the patient was a metastatic breast cancer and who insisted on using the scalp cooling. So if we see, there was a significant amount of reduction in the grade of alopecia with usage of scalp cooling, and it was found to be more effective in reducing chemotherapy-induced alopecia in patients who were treated with the taxane-based chemotherapy over anthracycline, which also supports the studies that have been published previous to this. Scalp cooling sessions were very well tolerated, and metastasis in the scalp as well as discontinuation was observed to be very rarely. So to conclude, scalp cooling system is quite effective in reducing chemotherapy-induced alopecia. Actually, it is the only prevention that you can offer to the patient who is going to receive chemotherapy with some clinically meaningful benefit, especially the breast cancer patients who are receiving neoadjuvant or adjuvant chemotherapy. If you compare it with the control where all the patients experience significant hair loss, it has been found to be more effective in patients who are treated with the taxane-based chemotherapy. In our experience, docetaxel carboplatin or docetaxel cyclophosphamide regimes are very, very well received with the scalp cooling. Treatment is safe and it is well tolerated in most of the patients. Thank you so much.